All right, guys, Dr. Nick here, talking a little bit about the pain, rest, deconditioning, vulnerability cycle, right? This process is going to be important to understand as a coach, clinician, or as an athlete, right? It's often we see an initial pain experience from an acute overload in a certain tissue. Right? That could be from one specific movement or a volume of movements. And what we need to appreciate is that when a tissue is overloaded and we are experiencing acute tissue damage and pain, right, our body is in a protective response, right? And that's normal. Our body is trying to protect us and tell us that maybe we should not be using this tissue, this movement pattern in this phase right now, during this time. For example, a torn ACL, right? We may have some pain associated with that injury, right? There will be swelling, there will be pain, there will be limitations in our range of motion, right? Our body's telling us, hey, maybe we should not be using this right now, okay? To prevent even further damage. Now, where this can go wrong is when we experience maladaptive beliefs or given poor education about our injury process. And so a healthcare professional, the internet, Google can be a scary place sometimes, right? And it can inform us or try and educate us with probably good intentions about what we're experiencing and what we're going through right now. Now that can set our clients up for failure, right? It can lead to fear. It can lead to other psychosocial factors that can actually increase our pain experience. So it's important in this time that we understand, that our clients understand that probably pain is normal right now and it's protective in nature and it's a good thing. And we should reassure them that the body will recover and it always wants to get back to homeostasis. It always wants to get back to baseline. And we're gonna be here to let your body do its thing, right? We're gonna guide you in that direction. Now, there usually will be some period of rest, right? Now, if someone is maybe not being guided or doesn't have assistance in this process, they may think that they need to rest forever. They may need to totally deload a certain movement or eliminate a food group, we'll call it, right? Now, I think we know that maybe some rest is needed in the initial stages, right? As coaches, I think what we're trying to do is how do we keep people moving, right, without compromising or increasing load on this compromised tissue right now, right? And that's where good coaching comes in. Can we find movements that allow people to continue to improve their fitness, continue to improve their training without increasing sensitivity or irritability or pain in that body part, okay? So again, rest allows the body to get back to baseline and restore that tissue's capacity. Now again, maladaptive beliefs, we may think that we have to rest for 6 months, for a year, or eliminate certain movements or patterns, right? And that can be very dangerous. And again, this is where, as a coach or clinician, we can make a huge impact on keeping people moving, right? And aiding and guiding that healing process. Now, if we stop there, again, and we want to get back to moving, we want to get back to performance or doing our activities, we're going to be in trouble, right? Because that leads to deconditioning, right? When I decondition, okay, I lose capacity, right? I probably experience kinesiophobia, which is fear of movement, okay? Or hesitation about what my body is capable of. Again, pain, initial stage, right? There will be a time of rest there to let our body get back to baseline. When I have prolonged rest and non-use, that's when those structures in that body part or in that area start to decondition, right? And usually, if I'm not reintroducing those movement patterns, I start to experience kinesiophobia, fear, and hesitation, right? And those things inherently are going to lead to vulnerability. Because the reality is we are going to experience stress in our life. And you will either be prepared or unprepared. The way that you prepare is by increasing capacity, by deliberately and intentionally stressing your body. And for tissues that have been compromised and their capacity has decreased over time, secondary to pain, it's even more important that we increase those tissues' capacity so that they are ready to handle the inevitable stress that they will face in their life, okay? So when you remove a certain movement pattern or you remove stress from an area, capacity decreases. After an injury, it becomes even more important once we understand that the tissues are not compromised and I can handle little bits of dose, that we gradually progress them and progressively overload those tissues so they adapt and increase capacity so we can handle more without being vulnerable for another injury, okay? So pain, rest, deconditioning, vulnerability, all very closely related. What we do, what we say, how we manage things right here prevents this, okay? Coaches, clinicians have a big responsibility to use appropriate language around pain, around expectations around pain, about educating clients and patients on the natural stages of healing and what pain is and what it means. And we also have a responsibility of understanding exercise selection, biomechanics, dose response, so that we can take someone who has no trust in themselves, in their body, in their movement, and show them that they can be strong, they can be capable, because we're setting them up for success with our exercise selection and progressing them appropriately. This person will not trust a personal trainer or coach if you put them in a position where their injury is re-aggravated consistently. It's not going to work. That person's going to give up and say, I'm not cut out for this. So we need to be better. We need to be better right here after this phase where we're getting someone back into movement. Okay? And again, that's where our foundational knowledge in exercise, in biomechanics, in regressions, lateralizations, and selecting the right dose all become increasingly important. I hope you guys found this helpful. Pain, rest, deconditioning, vulnerability. See you guys next time.